is discreet and hard, then that is a sign of breast cancer. Hello guys, and welcome back to my channel. In today's video, we'll be talking about the breast. We are introducing in this month of October the Women Health series. What is it going to be about? It's going to be about basically everything about the body of a woman. I'm going to leave in my email for you to contact me via email. Everything is strictly confidential. On things that bothers you as a woman or things that bothers you as a man because of your girlfriend, your partner, your wife, send me that email and we'll talk about it in this very month of October. So, if you're seeing me for the first time, my name is Chidima. I'm a registered nurse. I live and practice in the United Kingdom. We are talking about the breasts. Yes, trust me, there are basic things that you didn't know about your breast as a woman, and that is what we're talking about today. So without wasting time, let's jump right into this video. We're going to be talking about the breast today in different segments. I'll be giving you a brief description of the breast, which you may or may not know, just to enhance your knowledge about it as we go on. We're going to be talking about the functions, the conditions, the medical conditions associated with the breast. How do we take care of our breast? And facts that you didn't know about your breast. Trust me, those facts are interesting. You basically didn't know about them, or you knew about them but didn't know about them this much. So stick around with me to the end of this video. I'm sure you're going to get value from this video. And if you like such content, go down to the description, subscribe. Share the channel to your friends. Let's jump right into it. Let's start with the anatomy of the breast. In basic terms, the breast is a very important sexual part of the female anatomy. It contains ducts which transports the milk via the nipple. It contains some lobules or some glands where this milk is stored. It also has the nipple, it has the areola, and it also has lobes. That is just a quick description of the breast. Let's go ahead to the use of the breast, the function. This is where I have a bit of a bias about the function of the breast, because most studies will tell you that the basic function of the breast, which is the basic reason for the creation of the breast for the woman, is production of milk, storage of milk, and breastfeeding. Yes, but this is just a primary function of the breast. There are other secondary functions of the breast, and that is with sexual pleasure. Yes, the breast is also created for sexual pleasure. That's the secondary function. And again, I'm going to add the third one, beauty. Yes, because not everybody is going to breastfeed, isn't it? Everybody's not going to breastfeed. Some people have chosen not to breastfeed, and that is because their breast is for beauty. The medical conditions associated with the breast. After this, we'll be heading on to the uses. The first on this list is going to be breast cancer. Yes, breast cancer. About 1 in or 3, some studies say 1 in, and some say 3 in 13 women are being diagnosed with breast cancer every day. And this breaks my heart. Yes. Breast cancer is one of the major health conditions that comes with the female breast. And that is because the breast has been studied to be susceptible to hosting non-cancerous lumps. Yes. So that's why any of these lumps can at some point deviate and become cancerous. Breast cancer in itself is something that you cannot explain how it gets to you. For some people, it's hereditary. Yes. So if you have a family history of breast cancer, be it 2 generations back, then you have to get onto your doctor and do what? Do a mammogram, do your MRI, do your ultrasound scan. Check if you have the 2 types of breast cancer cells, BRCA1 and BRCA2. The doctor is going to check you out to know if you are hosting these cells. that can predispose you to breast cancer in the future, and probably give you instructions on how to go about your care of the breast. Yes. Now, for breast cancer, I'm going to be encouraging every woman to do what we call breast self-examination. Let me debunk that breast self-examination in itself does not prevent breast cancer from developing. The only function that it has is it opens your eye to early detection of maybe any distortion, any lump in your breast. The breast self-examination is going to make you aware of that. I'm going to be leaving a link in the description box where you can click and watch self-examination of the breast. Usually it is done 3 to 7 days from the first day of your menstruation. So that video is going to give you a hint on how it is done. If you do these examinations on monthly basis at the same time of the month, then you might be able to tell if there's any distortion in the shape of your breast, any distortion in the size of your breast, anything at all that has happened to the shape of your nipple. It will give you an idea of anything abnormal happening with your breast. That in itself does not treat breast cancer. That in itself does not prevent breast cancer. That in itself cannot handle the situation of diagnosing breast cancer. But as a woman, it gives you a clue that you need to run to the doctor. And then when you tell them that you've done breast examination, this is what you think has gone wrong with your breast, then they are going to do what? Subject you to MRI, which is magnetic resonance imaging, or they ask you to go for mammogram, or they ask you to go for ultrasound scan. But then the disadvantage of this is it warrants unnecessary biopsy. Yes, because once you have told your doctor that something feels different in your breast, then they are going to ask you to come over for a tissue to be taken from the lump you feel and examined in the laboratory to know if it's benign or cancerous. And then they can take up the treatment from there. That is the major thing about self-breast examination. But I encourage every woman to learn how to do it. The men, don't say that this video is not for you. It's for you. Remind your spouses, remind your partners, remind your girlfriends that they need to do this every month to be sure that their breast in itself is intact. All right? So that breast cancer is a topic in itself, but because we are treating about the breast, that is why I just have to highlight one or two things about the breast cancer. All right? Now, the second on the list for conditions associated with the breast is breast mastalgia. That simply means pain in the breast. There are so many reasons that can make you experience pain in the breast, which might not be worrisome, and one of them is engorgement of the breast. This is for breastfeeding mothers. Yes, it is for breastfeeding mothers. If you're breastfeeding and the amount of milk that you are producing does not equate to the quantity the child is taking in while breastfeeding, it's going to lead your breast to engorgement. Or if you are breastfeeding and you are not emptying one particular breast completely before going on to the next, then it's going to lead to engorgement because it puts pressure on the sides of the breast and thinning out the ducts that supply the breast milk, making your breast to be engorged and hard and painful. But then with time, over days, it's going to subside as the baby improves in breastfeeding. So breastfeeding in itself is another topic we'll be dealing with along the line in this channel. So if you're interested in that, make sure to subscribe because I'll be bringing that topic to you very soon. That is that. Engorgement of the breast can lead to pain. Now, ovulation can cause you to have pain. Ovulation is that time of the month where a woman releases an egg from the ovum, and then 14 days after that, your menstruation comes. That's another topic in itself, but we are highlighting it because we're doing what talking about the breast. During ovulation, your breast tends to get swollen and causes pain. That in itself is not concerning. Yes. Now, another reason why you can experience pain is lump. You've got a lump in your breast, you've done your self-breast examination, and your doctor have seen you, but this lump is discreet. This lump used to be very mobile, and at the same time, at some point, it stops to be very mobile and became fixed or barely moves, and it causes pain, shooting pain in the breast. When it's discreet and hard, then that is a sign of breast cancer. So breast cancer is another topic for another day. That kind of pain is associated most times with breast cancer because the usual lump in the breast is kind of soft, it's not hard, it's not discreet. It causes no pain. What it does is maybe during the time of the menstruation, the ovulation, little hormonal changes just touches it and your breast is swollen and it's paining you. That in itself is not worrisome. But if you have this discreet lump in your breast that is giving you pain, that is very worrisome. And 99.9% of the time is labeled down to breast cancer. And you need to rush to your doctor and get yourself evaluated. That is it for breast mastalgia. Breast mastalgia in itself usually happens because of the cyclical changes that occurs in a woman's body monthly, which is not worrisome. But if you've got a distinct pain, then you need to go to your doctor to get yourself checked out. That is another reason or another condition rather for pain in the breast, which is a medical condition that can be associated to the female breast. Now, another thing that you can find that's peculiar to the female breast is galactorrhea. What is galactorrhea? That is lactating when you are not breastfeeding. Why are you lactating when there's no baby sucking? That is the question. And trust me, a lot of young girls, a lot of young female adults experience galactorrhea. And the reason is just simple. Most times galactorrhea is because you are having hormonal imbalance. The prolactin in your body is way too high, and therefore your breast starts to lactate. So you need to get back to your doctor or your gynecologist to get that fixed, have a hormonal blood work done for you so that they can figure out which of the hormones are playing around. Because if you've got high prolactin in your bloodstream and you're trying to conceive, it's a problem. It can lengthen the time you are meant to conceive. That's the problem in itself. You need to see your doctor for that. That in itself, most times, it's not worrisome, but it can be because it's not normal to lactate when you are not breastfeeding. Another breast condition which is worrisome is nipple discharge. Yes, nipple discharge. If you are experiencing some discharge from your breast, discharges like blood, discharges like clear fluid that is unexplainable, particularly that you're not fiddling with your breast, you're not pressing hard on your breast, and you're having those discharges come out from your breast, my dear, you might be going down the route of breast cancer and you need to rush down to your doctor. You see, nearly all the conditions that females can experience during a lifetime as a result of their unique sexual anatomy, all of them are still rallying around breast cancer. That is the major reason why you need to take care of your breast. Now that we have dealt with some of these medical conditions that can be associated with our breasts, there are still one or two, the likes of mastitis, inflammation of your breast, maybe due to bacterial infection or breast engorgement. Now we're going to go down to the care of the breast. How do we care for our breast? Most people do not know that as a woman, the breast requires care. It's not enough to go inside the shower and give yourself a proper shower. That's not enough. There are things that you need to do when it comes to care of the breast. Now, number one on the list is probably what you're not expecting. Alcohol. Yes. How is alcohol in this surfacing in this care of the breast? A research has it in one of the medical journals that a woman who takes alcohol 3 times a week increases her risk of having breast cancer by 15%. Is that surprising to you? Yes. Alcohol in itself is not a crime. Drinking alcohol is not wrong, but you need to minimize how much alcohol that you take. You see the breast cancer coming again. That is the first thing about taking care of the breast. Your lifestyle, you can see lifestyle playing in. If they're talking about alcoholism, that means that is lifestyle. It means that if you're drinking too much of an alcohol, you need to reduce how much alcohol that you take. Now, this is research. It may have happened for some women and it may not have happened for some others. It might just be 1% of the population that has had this diagnosis of breast cancer associated with alcoholism. You need to check how much alcohol you are taking in as a woman. Now, the second thing we need to do about care of our breast is putting on a proper bra. The breast contains muscles, and these muscles, if not properly taken care of by packaging the breast so well, can get weak and result in sagging. I told you guys earlier that one of the functions rather of breast is beauty as a secondary function. That's what it is. If you care so much about your looks, care so much about how your breast presents when you're dressed, then you need to wear proper bra to make sure that you're supporting the muscles to prevent sagging. Now, know your family history. That's another way you can support your breast. You can care for your breast until your lifetime on earth finishes. Know your family history. If you got a history of breast cancer, please run to the doctor. They need to check if you've got BRCA1 and BRCA2, which are the cells or genomes that are found in any woman that has a trace of breast cancer coming in or surfacing any time of their life. The next way to care for your breast is breastfeeding as long as possible. God, who has given a woman the breast to breastfeed when they have babies, is very intelligent and knows what he's doing. Long or prolonged breastfeeding reduces your risk of having breast cancer, even if you are predisposed to it. So that's why exclusive breastfeeding is encouraged. I know it might be very difficult, but if you have, traces of breast cancer running in your family, it's going to help you. Breastfeeding for long is another way that you can care for your breast. And above all, make sure you do a proper wash on your breast, particularly under your breast, especially if you've got big bust, because sometimes it's quite difficult for air to go under. So you need to make sure you do due diligence under your breast to prevent soreness. So let's go right to the last one and the interesting part of the whole thing. Facts about the breast. You probably knew these facts or you didn't know them. Let's jump right into them. The first is that the size of the breast for every woman is hereditary. Yes. Your chest size, you can either pick it from your father or from your mother or from the lineage. So the size of your breast most times is hereditary. And the next fact about the breast is that one breast is usually larger than the other, and most times it is the left breast. You have either noticed it or you didn't. So the left breast most of the time is larger than the right breast. That in itself does not say that there's an abnormality with that. No, it's just the way God has made it. Now, the next fact is that breast cancer runs in families. Yes, some other people can develop breast cancer due to lifestyle, but it runs in families. Most of the time, it runs in families. And the next fact is that sagging of the breast is inevitable. Yes, my sister, sagging of the breast is inevitable. Look, everything about humanity deals with age. No matter how you try to carry your breast, no matter the amount of feminine bra that you put on, no matter whatever you do, the breast muscles will fade as you are aging, resulting in sagging. The only thing that will prevent sagging of breast is when you do a corrective surgery, like the augmentation, using the silicone bases and all of those things. Those are the only things that will do what? Prevent your breast from sagging. that in itself has its own consequences. I know they have its own consequences. So sagging is inevitable. There's just basically nothing you can do about it. But while you're still in your youthful age, yes, I mean, you have to package until the old age comes. Nobody sees an old woman and expects their breast to stand. That's abnormal. Anybody who sees that, it's abnormal in their thoughts. Now that you're young, make sure to package your breast well so that when you're old, you tend to appreciate it more because you used to know what it looks like when you were much more younger. So sagging of the breast is inevitable. There's just basically nothing you can do except you deprive nature from taking its course and going for corrective surgeries. That is that for sagging of the breast. Now, did you know that running extends your breast by 8 inches? You know, when you're running, your breast is moving up and about, up and about. It extends your breast. That is the more reason why you have to put on a fem bra or sports bra when you are running or doing any form of exercise. This is where we'll be ending this episode of the woman's breast. I'm sure you grabbed something from this video. There is more to come in this month of October in the Women's Health series. Make sure to subscribe. Yes, subscribe, because if you don't, you'll be missing out. And don't just subscribe, there's a bell icon beside the subscribe button. Turn it on so that whenever I upload a new video, you'll be sure to get the notification. Share this video to the rest of your sisters, friends, wives, so that they can benefit from this video. Health is wealth. Don't chase every other thing in this world, leaving your body, leaving your health to suffer. This is what we do in this video, talking about your body, talking about